So I'd like to welcome to the stage right now George Sousa as the moderator and Joe Hoeper. Joe is an attorney with international law experience and served as the chief deputy trial attorney for the city and county? City of San Francisco. And Dr. Kim Washington, who is both a chiropractor and a physician, a PMR physician. And Dr. Washington obviously has both experienced and delivered integrative medicine, so we're very happy to have her here with us. And Craig Brandt, who's going to leap the stage. Someone's always testing my boundaries here, I don't know. Craig, as you know, is a board member of ICIM and one of the co-founders of ICIM. He's also an amazing attorney, representing often, you and I might call them lost causes, environmental justice, and helping people who might not otherwise have access to legal. But he's here today as a patient, so don't ask him any legal questions, and I'll turn this over to George.
Hello, everyone. First off, I'm humbled to be with these great people, and also from the context that people talked about. Part of it is obviously education, integrative medicine, but there's always different sides of perception. From my standpoint, I'm honored and excited to be here. I came from the side of, briefly, I met Dr. Matecki in a training I was given in San Francisco when I lived in Hawaii, and it was 12 years ago. And at the end of it, she walked up to me and asked me, hey, would you be willing to do some business coaching or anything like that? And I said, no, I'm contracted with the company, and it would be not appropriate or legal for me to work with their clients. And so she said, well, I'll call you later on based on a certain time period where then I could talk to her. And of course, if you know Amy Matecki, she is a pit bull, and she did follow up. And ever since then, we've been close, and that's what kind of brings me connected, plus losing my father to prostate cancer, taking care of my uncle who had liver cancer till he died, taking care of my mom 2 years ago when she passed. So I have that side of it. They have the side of I haven't walked a mile in these people's shoes. But from the context, it's all about healing. It's all about solutions. And unfortunately, it's about cancer too, but it's about the people that brought themselves to the situation, much like that gentleman's question about how much does the mindset matter. And I believe I've seen it in my family, I've seen it in some of the patients, I've certainly seen it in Amy, and now we're going to hear from these wonderful people about what they've experienced from their own personal journey. So I am going to use my phone only because referring to questions. So, first question, and I'm going to refer to Craig, Joe, and Dr. Kim Washington in that way. I've asked permission of how they want to be referred to. Let's start with Dr. Kim Washington. And the first question, and again, Charlene had mentioned from both sides, she has multiple perspectives from a practitioner as well as a patient. What was the situation going on in your life at the time and the impetus that drew you to an integrative medicine approach? And if you want to share professionally and personally, that's fine. However you'd like to answer that.
Thank you, George.
Sure.
Thank you, George. Is this working?
It is now.
Oh, okay, great. Thank you all. It's an honor to be here. Thank you, Dr. Matecki, for the invitation, being part of this panel. If it's with the permission, I'll start out that I had a non-traditional pathway, and this is even amongst folks who have non-traditional pathways. My career in healthcare started as a chiropractor, and I practiced for 10 years as a chiropractor. So my start was as a provider. Chiropractic offered me, first of all, the training offered me tremendous intellectual stimulation, the knowledge, the challenges, learning, and then the relationships with the patients. So the patient care, the opportunity to be a part of someone's path towards healing. So as a practitioner of integrative medicine, or as a chiropractor, it was really being able to treat the whole person, seeing the person, being able to engage them. Medicine, Western medicine, allopathic medicine is not very subtle. And the chiropractic allowed me to help work to optimize the patient's healing capacity. That was very important, and it's something that I took into medicine. I subsequently went into medicine, was pleased that I was welcomed, open arms, to become a physician. Long story short, went to the University of Rochester for medical school, and worked at a VA in Arizona. I worked at the Ossler Center for Integrative Medicine at UCSF. I worked at the county with Dr. Freely, and now I'm at Summit Hospital. And then I subsequently, so I took care of people with pain and all number of disorders as a rehab physician. I think I got on this panel because then I recently had my own injury with gardening, with back pain, and I discovered immobility and an inability to take care of just basic day-to-day activities. As we say, the activities of daily living required assistive devices simply to get dressed, to get on and off of the toilet. I started out with a CT scan and the whole traditional medicine approach, lots of medications, which were important and helpful, but it really was the work of acupuncture and Dr. Matecki that brought me back to work, an ability to take care of people. I got back on my yoga mat, which happens to be my main medicine, and able to get back and feel whole again.
Great. We'll hold the applause till everyone's gone through so we can keep moving. Excuse me, hold the applause so we can move through for time. Thank you very much. Moving on to you, Craig. Same question.
Craig, you're on the mic right where you're sitting. Inside.
You're sitting on it.
Sitting on the mic.
There we go. That would have been a good instruction. Your mic's under your rear end.
Yeah.
Okay, so same question. I'll repeat it just so that we can hear it. But basically what was going on at the time in your life that drew you, or how you got drawn to integrative medicine, and then also kind of your disposition, however you felt getting involved in that, your journey to start.
Okay. Well, it all started actually with cancer. I was 49 years old, and I don't smoke and I don't drink, and I'm pretty healthy. And I, for a long time, was not I had seen a doctor, and I had this pain in my throat and in my jaw, and it turns out it was cancer in my tonsils. And in my lymph nodes on my left side of my neck, and then all the way down my throat. And so it was stage 4, and it was pretty advanced. And at the time, I went through all the various treatments that Western medicine has to offer, and I'm very grateful for that. Chemotherapy and surgery and radiation treatment. And it pretty much wiped me out. It almost killed me, but that's what Western medicine does to try and kill the cancer. In the process, you slowly die, and it becomes a race of, can you outrun the cancer? And after I finished all my treatments, I had been in and out of the hospital a couple times. And the last time I was in the hospital, I was in it for 10 days. And I still think about this. They literally put me in palliative care and didn't mention it to me. And they called up my wife and said, bring down the 2 kids. It would help Dad to see them, cheer them up. And what they're really saying is they couldn't do any more for me. And when I figured out that that was the case, I got myself out of the hospital. And I got home, and I was on a feeding tube, and I would go in every day for extra fluids and whatnot. And it was at that point when I was at home that my brother-in-law said to me, you know, you should try acupuncture. I have a colleague who did it with Dr. Machecki, and it might help. So I did. At that point in your life, it's like, well, I've tried everything. Why not try something new and exciting? And I was down to 138 pounds and not doing well. And I dragged myself to see Dr. Machecki. And the first time I had acupuncture treatment in my life, I thought, well, okay, I didn't really actually, it didn't do a whole heck of a lot the very first treatment because I was so sick. And on the way home, I remember I had to pull over, or the driver had to pull over, and I had to throw up on the side of the road. But that was on a Tuesday. Then on a Thursday, I came back, second round of treatment, Dr. Machecki. And I remember thinking, God, there must be 50 needles in me at this point. and Dr. Machecki's like, yeah, we're going to really load them up. And so she did. And after that treatment on the way home, again, it's like, what the heck? A whole door opened up for me. I wasn't nauseous. And I had been nauseous since day one with chemotherapy. So it had been months that every day I was sick to my stomach, throwing up every 2 hours. That's why I was on a feeding tube. And now this is the first time that the nausea just went away. And I can tell you, I can take a lot of pain, but the nausea was something that was really, don't want to go through that ever. And all of you who've ever been, car sick or on a boat sick, imagine that, 24/7. So the acupuncture stopped that. And that was the first thing I noticed. And I thought, oh, okay, something's going on here. I don't understand this. How can it be you stick needles in me all over these different places and it's healing me? And it was. And so that was the start of my journey with Dr. Machecki. I remember soon thereafter telling Amy that, okay, this stuff works. Why isn't it in every hospital? Why doesn't every clinic have it? And, I got to do something about this because that's the personality I am. And so here I am today.
All right. No, it's yours. You get to sit on it in between. All right. So, same question. Sorry about the feedback. To Joe.
Hello, everyone, and Amy, thank you very much for inviting me. My story, thankfully, is not nearly so harrowing as the one we just heard, but I was, as was mentioned, a trial lawyer for the city of San Francisco, and in 2007, I was diagnosed with stage 3 breast cancer, and did the then conventional series of treatments, chemotherapy, surgery, chemotherapy, radiation. And somewhere early in that process, my then oncologist, Martha Tracy, said, there's this program here at Alta Bates, and maybe you want to go see Dr. Machecki. And so I'm like, okay, cool, whatever. And so I started seeing Dr. Machecki, and I don't want to say I cruised through through chemo and radiation, but it was close to it. I was working pretty much full time during chemotherapy. Never was nauseated, and I attribute a lot of that to Dr. Machecki. And then part way through my conventional treatment, I developed very severe lymphedema in the side that had the surgery, and started a series of conventional treatments for that too, which involved at that point, heavy compression sleeves, a heavy glove. I was told not to use my left arm, and it was it was challenging. And I kept seeing Dr. Mateki for acupuncture, as I had been doing, and Chinese herbs throughout my treatment. And she was frustrated and kept telling me that in China, the normal course, or the typical treatment for lymphedema is acupuncture. But that was a big no-no here, because God forbid that you would actually stick a needle in a limb with lymphedema. And so this conversation went on for a couple of weeks, and my hand was immobilized. I had this huge sleeve, I had this glove, and was getting more and more frustrated. And she kept saying, I wish I could treat you, but it's against the standard of care here in the United States. And I finally turned to her and I said, look, I'm a lawyer, I understand the standard of care, but I trust you and I think you trust me, and so essentially to hell with the standard of care. Would you please treat me with acupuncture, because it's been so successful in all the other, in dealing with my other symptoms. I want you to fix my arm. And so she did. And that started a series of studies and further development and research by Dr. Mateki into the use of acupuncture to treat lymphedema, and I can talk a little bit more about that. But essentially, if you ask me today to list, what health issues I have, I'm not sure that I would come up with lymphedema as something that I have until I went through a whole list of other things that I could whine about. And so, and now my understanding is that acupuncture is widely used here as a treatment for lymphedema. And again, I can talk a little bit more about that.
Okay, I'm going to transition and leave you with the next question. Oh, and a different mic, I guess. And the next question, continuing on, Joe, would be pretty loud. Okay, let's really loud. What has been your experience? You talked about some of those, the challenges and your results. I think you've already talked about mostly by making that decision, but if you want to continue on and take the rest of the time and complete what you'd like to about that whole situation.
Sure. So I don't remember doing this, but Dr. Mateki says that I basically drafted basically a permission slip for her to go ahead and violate the standard of care and treat me with acupuncture. And that resulted in sort of a first phase study of, first of all, whether it was safe. And so I would go in for acupuncture and get a whole ton of needles in my arm, and my arm would be measured before and after, and I could see, and I could see it in my own arm, and I could also see it from the measurement, a difference every time that I received acupuncture, and that study, also established that it was, perfectly safe to use acupuncture needles in a limb with lymphedema. And based on the safety study, then Dr. Mateki went on to develop more research to show that it actually was effective. At the same time, I was also violating all of the other rules for treatment of lymphedema, which is that you're supposed to immobilize the affected limb and not use it. And that didn't make any sense to me because in my non-medical world, it seemed to me that contracting your muscles and using the limb would help to move fluid out of that limb. And so I proceeded to ignore all that advice and, went to the gym, lifted weights, rode my bike, did One of the things I noticed was when I did a spin class and was drenched with sweat, the affected arm, my left, was much wetter. I could see more surface fluid on my left arm, and I could see. Can you hear me? Am I going in and out? Okay. I could see a difference just from my naked eye that exercise was also benefiting my lymphedema. And so I learned, I mean, that was a really good example of advocating for myself. Now, I do understand that lymphedema is an observable condition, and I could see cause and effect and experiment without like doing a lot of permanent damage. And I think that's different for other conditions, but it was something that I could see, advocate for myself and see cause and effect from using acupuncture and also ignoring all of the other advice.
Thank you. So obviously there were experiences and challenges both in the legals.
If you just put it up to your mic, he'll adjust.
Okay.
I want you to talk a bit closer.
Got it. Okay. So obviously you shared about those. So if we could go to you, maybe from both sides of the coin, I don't know what experiences and challenges and also results you've talked about it, but maybe fill in any of the blanks from a practitioner side and then also from a patient.
Thank you, George.
Sure.
Yeah, I would say starting out with, from my current work as a rehab physician, so taking care of patients in the hospital when the unimaginable has happened. Multiple traumas, so lots of fractures, spinal brain injuries, acute stress response, lots in care of people with cancer, strokes, amputees, a full range. If you don't want to have me be your doctor because it means something terrible happened, if you need to see me in the hospital as a rehab doctor. So I was absolutely thrilled to have integrative medicine be one of the consult services that I could use, right? In addition to the neurologist and the pulmonologist, the cardiologist, integrative medicine, and any one of these folks who come through will tell you every day I'm sending referrals. Why wouldn't I? The stories of what's happening up here, it is a daily observation of efficacy. I once said Western medicine isn't very subtle, and one of the things the integrative medicine services do is they really reach in and help, they allow the individual to participate in the healing process. We optimize the body's capacity for healing, and take into that full consideration. So, so I use, as a practitioner every day, I observe the lack of any adverse effects. So from integrative medicine happening, there's not adverse effects, and there's very little medicine that I can use that doesn't have some GI, cardiovascular, hypotension, some kind of adverse effects on the outcomes for the patients that then often we may have to use another medication to address that. So integrative medicine doesn't have those side effects, which is fantastic. The other thing is, it gets in and addresses the quality of life. It's the whole person. It's not just a reductionist biomedical treating, and the outcomes. We haven't yet defined, we haven't yet identified the breadth and the depth of the healing that happens with integrative medicine. I often will say, lack of evidence is not the same as evidence of lack of efficacy, right? So we're not going to do any harm. And I'm observing on a regular basis, thank you very much, I'm observing on a regular basis the decrease in analgesic medicine use, the improved ability to participate. My patients participate in 3 hours of therapy, 6 days a week, capacity to maximize the use of what the therapists are doing. And to myself, I was able to get back to work. I was able to get back on my yoga mat, of all things. I was able to reintegrate my own life when I was immobilized with pain, a back injury. So I think that's.
Thank you, Dr. Kim Washington. And Craig, I'll repeat it. The fill in the blanks as to maybe the challenges that you've experienced as a patient, perhaps also maybe in terms of moving forward in the legal field, and challenges and results that you could fill in that didn't answer in the first question.
Okay, so before I answer that question, I want to actually thank everyone who's here today. I appreciate you being here. Everyone in this room and everyone who's online listening right now, you're all healers, and that needs to be praised and thanked, and I am doing that now. My hope is that others will hear this and see this conference and open up their hearts and their minds to integrated medicine. Because all we're asking for is that we use every available option out there to help the patient. And that's what I'm grateful for. And the challenge is that we don't have that bridge yet. We don't have that connection between East and West medicine and all medicines out there for the patient. And it wasn't until after I had gone through all my Western medicine that I started my acupuncture and my Chinese herbs, and I felt much better. And you're all practitioners. I mean, it's not a surprise to you that the pain went away, that the nausea went away, that my immune system got better, that I put on weight, and my appetite increased. All those things, your doctors, your physicians, your healers out there, you know that. But the challenge now that we all face is a much bigger one, and it's one of trying to integrate Western and Eastern medicine together. And so, ICIM, that's been one of our main missions throughout. And when I first sat down and got to know Amy, and I realized that Amy had, was internal medicine and an acupuncturist, I thought, oh, this is so great, because I want to push this out there in the world. And my challenge has been, how do I get this idea of integrated medicine out there in the world? And here's this perfect person I ran into, Amy. And all the people now that have been attracted to Amy into ICIM, everyone in this room has been touched. And you don't know it, but you've been there behind me and helping me to heal. And I greatly appreciate that. And I thank you all for that deeply. But the challenge is for all of us now to find a bridge to bring all these modalities together. And so that's why you're here today. It's not just to earn your credits. It's not just to have praise and thanks, but it's also you got homework to do. And I'm challenging each one of you in here and everyone online that can hear me that, this is the future, integrated medicine. And it's going to take people like you that are brave enough to stick your neck out there and do something about it. And so I really applaud you for doing that. Thank you so much.
So back to you, Joe. The question is, with it being personal, the story, also the health conditions and challenges that you've gone through and your own health journey, I want to praise everyone for being willing to share what's intimate and what's close and what was probably very scary that I've never experienced, only from the other side, looking into my family's eyes. But why be here, and why are you willing to share this personal story and this information with people?
Well, I think the easiest way to answer that is to say I agree with everything that Craig just said. I mean, the people in this room and the folks that aren't here but are doing the same work are the reason that I'm here, happy and healthy now. And we all just need, I think, to take a role in trying to promote the availability of integrative medicine to others. I've had a number of family and friends go through, eventually fatal cancer fairly recently, and it's not easy to, first of all, talk to them in a way that will have them consider other options, and second, knowing what's out there, and who's out there that's good and trained and qualified, as opposed to someone out there sort of going woo-woo, doing woo-woo medicine. And so I think it's just, so the more that I feel like I talk about my personal situation, then the more that maybe other folks might consider trying, integrative medicine. And I can also, as Dr. Matecki, as Amy keeps saying to me, because she and I sort of entered into this conspiracy to violate the standard of care. Sorry. Back, I guess this is now, more than 15 years ago, there has actually been a shift in the treatment of lymphedema with acupuncture. And so to the extent that there are other patients out there who've benefited by me putting myself out there and sort of being a pain in the butt and pushing it, that just reinforces everything that Craig just said, and reinforces the need for all of us to speak out. And I'll just stop by also echoing what Craig said and thanking everybody in this room for all of your work, both with patients and in changing the way that integrative medicine is perceived here in this country.
Yeah, that's good. So again, the same question to you on a personal note or professional as well. You're willing to share your personal story here, and it makes a difference for sure, impacts a lot of people, myself included. Why do you do it, and what do you want to leave people with, if you want to say your last words and close?
Okay.
However you'd like to.
Thank you.
Sure.
Dr. Smalls earlier this morning said that on one of his trips to China, he identified that acupuncture is the people's medicine, and I would expand it that integrative medicine is the people's medicine, right? I do this because I'm committed to the care of people, the responsibility, the privilege that I have as a physician, the privilege that I had as a chiropractor. I'm still a chiropractor. I'm also a physician now, and that I'm practicing in the hospital, traditional as a physician. The tools are that, as I think I said this earlier, we reach in to take care of the whole person. It is. I went to the University of Rochester, where the term the biopsychosocial approach to medicine was coined in the 1970s, and they walked their talk that medicine had become narrowly focused, enamored by our brilliance and our technology, and busy treating imaging and lab results. And in the center of this is a person. And I think integrative medicine, that is integral to what we do, right? That it's who are you, what are your goals, and how do we advance that, and using all the tools that we have. And that doesn't just include the physiology or the pathology, it's also your psyche, it's your community. In fact, at Rochester, they're trying to expand biopsychosocial to also include an ecology, because it's our ecology that affects our well-being as well. I do this work because of the great privilege that I have to be able to care for folks, the commitment to optimizing people's outcome. They define what's best, and we work to take all the tools that are available to optimize outcomes. So I think that integrative medicine also, it helps people find their equilibrium, right? Find that homeostatic balance that gets shifted, and it's in all realms. I was speaking with a psychiatrist earlier. I'm not a mental health specialist, but I most certainly listen and engage on the psyche, on the mental component of illness and well-being. There's a physiologic component. There's the social, the family, right? Our support systems, our loved ones, that is also a part of getting well, right? So this helps people find their equilibrium. That was something that my mother said, and I lost her last year. Thank you.
And I'm going to allow Craig, if you want to, you said a lot, and maybe you said what you need to say, no, not in a bad way, but if you want to, any final remarks, and we'll wrap up on this, because time, whatever you'd like to say.
Thank you again, everyone, for being here. I appreciate it. ICM appreciates it. And I look forward to working with you in the future. All right. Thank you so much.
So if we would, thank all our illustrious, authentic, real people up here that shared their stories. Joe, Dr. Kim Washington, and Craig. Give them a round of applause one more time, please. And we'll exit the stage. You're a lawyer, be a rebel, whatever you want to do. Liability insurance optional. So I want to just say a few quick words that I had on the structure that I was asked to speak about by Dr. Matecki. I said a few at the beginning, but one of the things that I've experienced in the last 4 years was I lost my Aunt Mary Sousa, and after the 30-year battle. And the other thing that I learned from her was, at one point my father and I met with her, and she saw how happy we were and excited. And then she decided, after she met with us, because my father was in psychology and his background was in psychiatry, he was a medic in the Army, he mentioned that we had done some work in terms of counseling and things together to not hate my father who left my mother and to reconcile and be his best friend when he died in 2010. He was diagnosed with prostate cancer, and he said this to me one day when I was in Hong Kong. I was asking him how his treatments were going, and I was working. He said, I don't want to talk about cancer anymore. I want to talk about moving forward. I want to talk about your life. I want to talk about the grandkids. He said, from my standpoint, you know, when they tell you they're going to go in Hawaii, 99.9% we're going to get it, and it won't be a problem. He says, I want to tell you, it really sucks when you're that 0.001 that it spreads. And he died. And when he died, he had at least 30 bottles of Oxycontin in his condo that I picked up. He also had a revolver with a bullet in it, and he had it hadn't drank in 15 years, half bottle of rum and half a joint. And I know that was his way of saying, I don't want to hurt anymore. And he left his oxygen machine in the other room. His stepson is still a chair at Stanford University. And I'm not going to perjure myself, but basically told him, here's the easiest way to die. And so I got there to my father, and I know this, that when we were going there, he was already gone, and he made me swear as a young man, you will never wipe my rear end. You will never take care of me like that, because he had done it in the Army for so many people. And I said, Dad, I'd do anything for you. He said, no, I mean it. And so when he knew people were coming to get him from the Bay Area, Berkeley, his sister and my sister, that's what he chose to do. And so I just want to share as a layman, from taking care of my uncle with liver cancer with a bag outside of his body, taking care of my mother as she passed away 2.5 years ago, being the one that decided to do hospice and not knowing what that entailed. What I wanted to honor is what they looked me in the eye and said they wanted, and they wanted to go home. And so I'm not knocking anything about hospitals, but I know my uncle had the choice to stay in the hospital in Sacramento, not go out and see the sunshine because that wasn't something he could do, not smoke a cigar even though he had some time, a little cigar if he wanted to, and not listen to music too late. He ended up coming home because that was how he wanted to go out. And from my mother's experience and also from Dr. Kim Washington sharing, my mother was somebody that when she came home, we had 20 people in the family all come in, and she must have had had the most joyous day I've ever seen on her face, that the community and the people that are trying to care for people, and I'll just do real quick, how many have been touched by somebody with cancer in their family? Okay? And if you haven't, you probably will if you're around long enough. So I just want to say from my part, I love the work they're doing, and I wish I would have had a way to communicate to my father, to my uncle, and to my mom, who are very close-minded, that there were things that could ease their pain other than Oxycontin. So thank you very much for the time.